Hello, y'all. My name is Megan Clanahan. I am the co-owner of Houston Moms Blog, and we are back today with another special test from UTMB Health. And obviously, this is the month of love, but it is also very much Heart Awareness Month. And so we wanted to make sure we brought you all the latest information, really helpful hints and tips for our moms and parents out there and what you need to know about heart disease. So today I have joining me Dr. Berbarie. I said that correctly?
That's Berbarie or Berbarie. You got it.
Berbarie. There we go. See, I knew I would do it. I knew I would. So we are
Sure.
so happy to have you join us today. I would love to know a little bit about who you are, where you practice, and your specialty.
Thank you, Megan. It's great to be here with you. I'm a general cardiologist at UTMB. I have a clinic practice where I see outpatients and inpatients at our UTMB hospitals in the Clear Lake area. So we have two hospitals, Clear Lake campus and the League City campus hospitals, about 10 to 15 minutes away from each other. And then I have my outpatient practice all at the Clear Lake campus in Webster, where I see a variety of cardiovascular problems and symptoms. General cardiologists see everything from coronary artery disease to arrhythmias, valvular heart disease, and congestive heart failure. So I see a little bit of everything in my daily practice.
Okay, well, thank you so much for sharing that. And what I think we're just going to launch into it. Tell us about signs and symptoms of heart disease in women. They call it the silent killer because a lot of us aren't aware that maybe we have heart issues going on. So, what are some signs and symptoms of heart disease in women?
Sure. So first, women can have the same symptoms as their male counterparts. So those primary symptoms that we worry about a heart problem include chest discomfort, shortness of breath, whether at rest or on exertion, passing out episodes, palpitations, heart racing, pounding, beating irregularly. There is a typical description of what we call typical angina pain. And in research studies, it seems like women don't seem to read the textbook very well when it comes to those symptoms. So we do want to pay special attention to any kind of chest discomfort. So when we talk about typical angina, we're describing chest symptoms like pressure, tightness that can come on with walking, exertion, or stress, and gets better once you stop and rest. However, really, women can present with different symptoms. And so we need to be careful and pay attention to any kind of chest discomfort. So even symptoms like a sharp chest pain or a nagging pain or an ache, and even if it's not happening with exertion or exercise, those are symptoms that could potentially be signs of different forms of various heart disease and are warning signs that should be paid attention to.
Okay, so that's interesting. So my dad had heart disease, and it was runs in our family, and he complained. I think it was his right shoulder, as a pain for like a weekend, and then he ended up having a heart attack. Is that typically where we would feel the pain, or not so much?
Not so much, no, but that's your dad is an unfortunate example of what I just said, that we really need to just pay attention to any kind of chest discomfort symptoms. I think, especially as we all are getting older, heart disease becomes more and more prevalent as we get older. And so any kind of chest symptom in the shoulders, neck, and jaw, by the way, as well, are important symptoms to pay attention to, even if it's just in the neck or jaw, in the left arm in particular, as well. Those are other types of symptoms that could represent what we call equivalents of typical angina symptoms. And again, we should pay attention to those.
And I find it so interesting because I think as women and as moms, especially, we're under a lot of stress and we're getting older. And so almost like everything hurts, you know what I mean? It's
Mhm.
just like there's some days we're like, so, but pay attention to those reoccurring. If it's happening or if it comes on like that sudden onset sharp pain, that's something we need to pay attention to. So going kind of with that, who are the women that are most at risk for heart disease? What does that look like?
So yeah, so good question. So and of course, as I just said, as we get older, so as age starts to go up, we're all becoming at higher risk of cardiovascular disease. But if women have more risk factors for cardiovascular disease, those typical risk factors of diabetes, high blood pressure, high cholesterol, if you've got those other medical conditions, then you are going to be at higher risk of cardiovascular disease and events. If you're a cigarette smoker, that's a big risk factor for cardiovascular disease. So that's another risk factor to keep in mind as if you are having symptoms and thinking if I should get this checked out or not. Being overweight as well, having a sedentary lifestyle, not being very active, not exercising regularly. If you have a family history of heart events, in particular in first degree relatives of heart attacks, especially at younger ages. Yep, like yourself, like you just mentioned. If those first degree relatives like mom, dad, siblings have had heart events in their 40s, 50s, early 60s, then that is another significant risk factor that is going to put you at higher risk of cardiovascular disease and events.
Gosh, I think that, I mean, that's hard to hear. My dad was, I think, like 47 on his first one and like
Uh,
52 on a second. So, and his dad passed away very early, like 51. So given what you just shared with us in about risk factors and what we should be aware of, when do you all recommend that somebody sees a cardiologist? When do you make the transfer from like a primary care to a cardiologist? What does that look like?
Sure, good question. So we always want to partner with our primary care physicians, of course, because they're going to help us manage those risk factors. There's no set time that we say, okay, once you get to this certain age, you should go see a cardiologist. As we talked about earlier, those symptoms, I think for those symptoms, I would definitely get those checked out with a cardiologist. I think if you're asymptomatic, this is a question that comes up, is when should I get my heart checked out? As I was saying, as we get older, cardiovascular disease becomes very prevalent. So it's like you've got to reach a point where I got to get things checked out, right? The problem is there's no really set way to screen for cardiovascular disease or for somebody to say, okay, not like when you turn 50 and it's time to get a colonoscopy. We
Right.
don't have a set age for that when it comes to screening for cardiovascular disease in patients who are completely asymptomatic. So I go back to, as far as when to then get checked out, I go back to those risk factors. I think if you have multiple risk factors that we talked about, diabetes, high blood pressure, smoking history, family history, elevated cholesterol, even if those risk factors are all well controlled by your primary care doctor, then I think that that's probably a good time to go get a screening test or at least a screening evaluation. Cardiologist might say, all I need is a baseline EKG in this case. But I think it's very reasonable with the multiple risk factors, even in asymptomatic patients, to go get screened for cardiovascular disease. Otherwise, I tell patients, best thing you can do early on is to get yourself established with a very good primary care provider who can then pick up and screen you for those risk factors as you're getting older. And then key to prevention is getting these things identified early, lifestyle modification to help if we can do that early on, and then medication therapy if needed to treat those risk factors early on to get good primary prevention of cardiovascular events.
I think that's great advice. And so, again, those things that are hard to hear, but we need to hear them. So, how do we live that healthy lifestyle? What does that look like? What would the cardiologist tell us that we need to be doing?
Sure. So I think first, something that if you're able to do is exercise. Exercise can be so heart healthy in so many ways in terms of preventing and treating high blood pressure. It can help you maintain a healthy weight so you don't get things like diabetes or elevated cholesterol. So I'm a big believer in telling my patients, if you're able to exercise, let's get out there and exercise. And, the American Heart Association does have recommendations on targets for what you want to do as far as an exercise plan and timing. But I don't, I'm not, I'll talk about those, but I think it's good to just start doing some aerobic exercise. If your aerobic exercise is 10 minutes a day of walking, then start there with that. That's okay. The American Heart Association recommends trying to get about 30 minutes, 5 days a week of moderate aerobic exercise. So that would be like walking, a good pace where you can still have a conversation, but you're walking, you're getting your heart rate up 30 minutes, 5 days out of the week, or for 75 minutes of in a week of more vigorous exercise. So you could target that as like 15 minutes a day for 5 days out of the week. And when I say more vigorous exercise, I'm talking about running. Then you're doing something that you probably can't carry a conversation on with somebody, something like swimming or playing sports. Though that would be the more vigorous exercise to try to do. Other things you can do is eating a heart healthy diet. Now, what does that mean? Diet recommendations can really vary from physician to physician. And of course, there's all different kinds of diets out there. I like to tell my patients there's some key things you should just look at, I think, in any diet. I think portion control is very important. I think we probably eat too much every time we sit down to eat here in the United States. I think trying to cut back on carbohydrates in general is a great idea. Limiting your sodium intake to less than 2,400 milligrams in a day is probably also something very good to try to do in terms of blood pressure. And so those are some of the general points to think about when we talk about a heart healthy diet. And then another big thing to talk about for lifestyle modification, if you're a cigarette smoker, please stop. Just please get to whatever kind of method you can use, medication, to get you to stop smoking. It's such a big risk factor, and it's modifiable in the sense that you can just take it away, right? You stop smoking, mark that risk factor off the list for you. So I think those are some general points to consider.
All great advice. And, I think it's obviously we're speaking to many moms here who we're busy and we are into our kids and we're making sure that our kids are taken care of and well fed and that they're getting out and running and doing the things, but we don't always take our own advice as to what we tell our children. So I think those are all great points. Do you have any last remarks on what you would like to share with our moms and our panel of parents?
Sure, I do. I have a couple of other things to mention. There are some cardiac risk factors that are unique to women, and I think they should keep these in mind because I think they might go under recognized in a lot of physician offices. One in particular, if you've been pregnant previously, if that pregnancy was at all complicated by cardiovascular disease or event, even something like high blood pressure, doesn't even have to be something that you had some kind of big heart attack or something really bad happen with your heart during the pregnancy, even something like getting high blood pressure during your pregnancy, which is very common, blood pressure that had to be treated with medications. In research studies, this has been identified as a big risk factor for women going forward for predicting cardiovascular disease like heart attack and stroke. And so this is probably an under-recognized risk factor in a lot of women. In one research study that I recently reviewed, the estimate is you could have hundreds of thousands of women with an unrecognized risk factor for cardiovascular disease. I ask all my women when I see them in my office about their pregnancy history. Were there any heart complications? Did you have blood pressure problems? Because that is something that should be addressed and taken into consideration when you're assessing a woman's cardiovascular risk. Then I'd also say another unique risk factor to women is those women that have had to get therapy for breast cancer. Chemotherapy, in particular, could be harmful to the heart. Great to treat the breast cancer and help to get rid of it for the woman, but there are potential side effects on the heart for different kinds of chemotherapy. So I think that's something good to review with your oncologist, what chemotherapy agents you've used, what kind of cardiac testing has been done already, and to see if whether or not you should see a cardiologist to screen you for any chemotherapy-related effects on the heart.
That is so interesting. Both like points I've never heard. I've heard the other things and other risk factors, of course. But we know so many of our moms have had preeclampsia or,
Mhm.
things during their pregnancy. That is not an uncommon situation.
Not at
Um,
all.
and so I find that so interesting. And then I think with the breast cancer, especially as we age, I just turned 40 this past year, about to be 41. So we just started all of that mammogram stuff. But as we get older, obviously our chances of getting breast cancer increase too. And now, okay, so I had never heard that. Um, but I think it's good to have that information. Education is power. So it's not like a death sentence. It's just like a hey, have a conversation with your general practitioner or whoever, or have a conversation with your oncologist and see if you might be a good candidate to go get screened by a cardiologist. I think that's what we need to know. So
Mm.
those are two great points. Thank you for that.
Sure.
All right. Well, I appreciate so much your time. I know it is a busy month as we all are in Heart Awareness Month. And I appreciate you taking the time this morning with me. And I hope you enjoy the rest of your month.
Thank you so much, Megan. Appreciate you having me on.
Thank you.